Welcome back to our amazing program, viewers, on your health, your wealth. Like I often say, do ensure to click on our like button and to subscribe to our YouTube channel, Diaspora Digital Media, to get the latest update. Women in Jigawa State have urged the state government to increase the availability of family planning commodity, emphasizing the need for easier access to quality and free family planning services. The economy is poor. Too much of burning is, is at risk. The appeal came as the state marked the 2025 Safe Motherhood Day, with many women expressing frustration over the challenges they face in accessing the essential services. Speaking with the News Agency of Nigeria, NAN, several women shared their experiences in a bid to raise awareness about the difficulties they face in obtaining family planning services. Zaliha Usman, a woman of 25, recounted how she first became aware of family planning services during a previous antenatal visit. She explained that despite obtaining her husband's consent to use family planning, her attempts to access the services in the state, that is Abuja, had been thwarted by the lack of available commodity. Since we decided to seek family planning 5 months ago, we have visited several facilities in Duste, but we were told that there are no commodity, she stated. Similarly, Madaniya Habibu, 26, who has 5 children, expressed her desire for more effective spacing between births. However, she was told she would need to buy the necessary commodities before receiving the services at a facility. Nigeria. The government should assist us by providing the commodities that were once freely distributed in hospitals, she pleaded. Please, Governor, help out. Hear their pleas. Amina Adamu, a service provider at Limachi Primary Health Care Center, also highlighted the growing demand for family planning services, but noted that many women, particularly those from remote areas, expect free commodity, not the key, free commodities. We often ask them to purchase the commodity, but many complain that the government has previously provided these items for free, she said, adding that the economic downturn has also made it difficult for families to afford the services. Ankele Kongude, program manager for the Challenge Initiative in Jigawa, that is the TCI, identified the procurement of family planning commodities as the key challenge facing the state's family planning effort. Please, Governor, you started giving them free. Why not continue your good deeds? He revealed that the state last procured the necessary commodity in 2022 with allocations for 2023 and 2024. Kongude emphasized the need for the state to establish a sustainable framework to continue the provision of quality family planning services once TCI exists in the state. Our goal is to promote a culture of implementation, efficiency, sustainability, and self-reliance, he said. Meanwhile, Owani Abdullahi, the coordinator of Matan Kakara, a community-based organization, echoed the concerns of women in rural areas. She highlighted how mothers struggle to manage large families in this difficult time, noting that many find it difficult to shape their children's moral conduct without adequate support. You can imagine that. Women with many children need enough time to properly care for them before having more. And the government should strengthen the family planning services to make them free, Abdullahi added. Of course, The economy is very poor. Now reports that attempts to reach the state government for comment on this issue of free family planning services were unsuccessful. The National Safe Motherhood Day, observed annually on April 11th, seeks to raise awareness of the risks women face during pregnancy and childbirth. First launched by the United Nations in 1987, the initiative underscores the importance of safe pregnancies and childbirth, contributing to efforts aimed at reducing maternal mortality in line with the Millennium Development Goal, that is the MDGs. Up next, the federal government has announced plans to commence a nationwide flood awareness campaign in May 2025 as part of efforts to educate Nigerians on flood risks and safety measures, especially as the raining season intensifies. The Deputy Director, Department of Flood, Erosion Control and Coastal Management at the Federal Ministry of Environment, Mr. Kunle Awojimila, disclosed this in an interview with our correspondent on Sunday. According to Awojimila, the campaign will kick off in the first week of May, starting in Dusty, Abuja, before moving to other flood-prone areas such as Lokogoma and Lugbe. He added that states across the Federation will simultaneously begin similar sensitization exercises. This development comes against the backdrop of the 2025 flood outlook report by the Nigerian Hydrological Service Agency, that is the NIHSA, which identified 1,249 communities across 176 local governments in 30 states and the FCT as flood hotspot between April and November this year. Minister of Water Resources and Sanitization, Professor Joseph Utsi, while presenting the report in Abuja, listed vulnerable states which include Abia, Adamawa, Akwa Ibom, Anambra, Bauchi, Bayelsa, Benue, Borno, Cross River, Delta, Ebonyi, Edo, Gombe, Imo, and Jigawa. Others such as Kebbi, Kogi, Kwara, Lagos, Nasarawa, Niger, Ogun, Odun, Ondo, Oshun, Oyo, Rivers, Sokoto, Taraba, Yobe, Zamfara, as well as the FCT. Usif lamented the rising impact of climate change, which he said has increased the frequency and severity of floods in recent years. He warned that coastal and riverine communities, especially each state like Bayelsa, Lagos, Delta, Cross River, and Ondo, may face serious challenges due to rising sea levels and tidal surges, which could disrupt fishing, destroy wildlife habitat, and hamper inland water transplant. Meanwhile, data from the National Emergency Management Agency, NEMA, revealed that in 2024 alone, flood disasters affected 217 local governments in 34 states, leaving 1.3 million people impacted, over 740,000 displaced, and 231 lives lost. Director General of NEMA, Mrs. Zubada Umar, has called for improved grassroots preparedness, warning that failure to act early could worsen the humanitarian impact of flooding. Represented by the head of NEMA's Ekiti Operation Office, Dr. Kofoworola Soleyi, Umar spoke during the conclusion of a 5-day grassroots sensitization campaign in Ado Ekiti over the weekend. It is important for people at the grassroots to know their risk exposure, basic safety measures, and emergency response actions, especially now that the rain are here, Umar stated. She noted that the NEMA Get Part initiative, which focuses on community-level education and practical engagement, is tailored to close the awareness gap in flood-prone communities. Well, as part of the campaign, NEMA officials stormed Ikere Ekiti and Ido Osi local government areas, advising residents in flood zones to be on high alert and relocate to safe grounds once water levels begin to rise. The agency emphasized that community involvement, early warnings, and proactive response are very, very vital in preventing massive loss of lives and properties during the flood season. Next, despite growing awareness, harmful traditional practices continue to thrive in many Nigerian communities, with health experts raising the alarm over the dangers they pose, particularly in children. One such practice is the insertion of palm oil, herbal concoctions, and other substances into the ears of children to treat ear infections, a condition reportedly common among the fives. Experts have now warned that this method not only worsens the infection, but could lead to complications as severe as hearing loss, meningitis, and even death. Please, mothers, stop using concussion on your children's ear. According to the National Institute of Deafness and Other Communication Disorders, 5 out of 6 children will experience at least one ear infection by the time they turn 3. So always have that. These are symptoms of growth. Symptoms include ear pain, discharge of pus or fluid, trouble hearing, or in some cases, clumsiness due to balance issues. In Nigeria, however, the common sight of cotton wool soaked in palm oil or native mixtures stuffed in children's ears has prompted child health specialists to call for urgent public education. Professor Omotayo Adesunyun, a pediatrician at the University of Ilorin, Kwara State, said the trend is disturbing and poses serious health risks on children. Using native concoctions or over-the-counter solutions to treat ear discharge is very, very dangerous. These remedies can push the infection deeper, perforate the eardrum, and delay proper treatment. She said it. Of course, the specialist lamented on it. She advised that any child with ear discharge should be taken to a hospital where proper diagnosis and treatment, usually with antibiotics, or should be led to the ENT specialist intervention, that is the ear, nose, and throat doctors. They can be administered drugs over there. Things listed that people use, native concoctions or herbal remedy. Experts warn that these mixtures, often made from herbs and spices, are untested and ineffective. Rather than heal, they worsen the condition, leading to complications like inner ear infection and even permanent hearing damage. So please, be careful of the things you use in your children's ear. Things also like cotton swabs. Dr. Leo Odudu, medical director of ML Hospital and a consultant pediatrician, said inserting cotton swabs into a child's ear is risky and could push the infection further. It can also injure the eardrum or create blockages that worsen the infection. He added too. Thirdly, things that people use, things like matchsticks, bobby pins, and even the fingers. We know that these are very common here in Nigeria. Some parents, in a bid to relieve itching or remove earwax, insert matchsticks or bobby pins into children's ear. Oh my goodness. Health experts describe this as one of the most dangerous practices, capable of introducing new infections or causing trauma to the ear canal. So please, take note of all this. We know that it's casual, but please take note of it. Adesunyu explained that children have shorter and more horizontal eustachian tubes, making it easier for bacteria to access the middle ear. Additionally, children in crèches and schools are more exposed to germs, increasing their risk. So please, parents, do not make a self-medication or the use of antibiotics without prescription, because all these things contribute to resistance and often leads to worse outcomes. President of the Medical and Dental Consultants Association of Nigeria, Professor Aminu Mohammed, also lent his voice to the issue, noting that untreated infections could spread to the brain and lead to sepsis. This is not something to take lightly. Yes, it's not. Persistent infections can cause irreversible damage to hearing, or in extreme cases, fatal complications. He also noted that conditions such as HIV, tuberculosis, and poor nutrition, which weaken the immune system, could make children more vulnerable to such infections. But you might ask, since fingers, matches, swabs like cotton swabs are now resisted, what is the way forward? Well, experts are urging parents to prioritize hygiene, nutrition, and early hospital visit when symptoms of ear infections are noticed. The earlier, the better. Good hygiene and proper nutrition are the first line of defense. But when infections occur, hospitals, not home remedies, are the right place to go, Dr. Odudu advised. Well, finally, Ogun State's Governor, Dapo Abiodun, has restated his administration's commitment to boosting food security and empowering farmers through strategic agricultural interventions. Wonderful. Speaking through the Commissioner of Agriculture and Food Security, Bolu Owutomo, the governor said assurance at the official flag off of the harvest of 80 hectares of cassava farmland in Ifonyitedu, Ipokia local government area. The initiative under the Ogun State Economic Transformation Project, that is the OG STEP, is aimed at enhancing agricultural productivity and improving the livelihood of local farmers. No be small thing. According to a statement issued on Sunday by the project communication officer, Simbo Olayinka, the project is part of wider efforts to address food insecurity and reposition agriculture as a key driver of the state's economy. Governor Abiodun disclosed that 80 farmers cultivated the farmland with significant support from the state government, including a 65% subsidy on land clearing and 50% discount on inputs such as cassava stems, fertilizers, herbicides, and pesticides. Each of these farmers is expected to earn a minimum of 2.4 million from the harvest. Wow! Abiodun State. Adding that the government had also resolved the challenge of market access by linking the farmers with reliable off-taker to ensure their produce is brought immediately, thereby reducing post-harvest losses. This initiative is not just about farming, it's about sustainability. The market is guaranteed for all produce, he said. The governor reaffirmed that agricultural transformation remains a key priority of his administration. Wonderful. Urging more farmers to key into similar programs for enhanced productivity and income generation. Well, speaking on behalf of the beneficiaries, Mr. Abiodun Yusuf commended the state government for the intervention, describing it as a huge relief for farmers in the area. I beg you, make una start to the farm. For both the first and second flooding, the project took care of 65% of the cost. The subsidy of fertilizers and other farm inputs really helped us, Yusuf stated. Also, present at the event was Dr. Ope Adejuwon, a representative of the project agricultural sector team, who stressed that the empowerment scheme is strictly for genuine active farmers. So if you're not active, don't expect this wonderful offer from the governor. So this program is not for political farmers. It is designed specifically to support those who are truly committed to agriculture, he added. So please start your farming work. If you are not farming, you can start now to get the support of the governor. Well, viewers, like I said, finally, we have come to the end of our news today. Be sure to like, share, subscribe, and comment to our YouTube channel. Subscribe to it, comment, share, so that you get the latest update. Until next time, I thank you for your time and thanks for watching our Diaspora Digital Media. I remain your host, Nenyo Michael Nene. Bye for now.